But thank you for booking onto this webinar with Jeannie DeBon. And Jeannie, thank you so much for agreeing to run us yet another fabulous informational webinar, this time on the foot. Just a bit of housekeeping for everyone. You will all be on mute to ensure everyone can hear Jeannie properly. If anyone needs to contact me, please use the chat function on here. I will just pop a little message there so we can all see the chat function. And questions as well, please enter questions into the chat section. I'm going to collate those questions and then I will pass them over to Jeannie at the end. If for some reason your tablet, phone, computer, etc. kicks you out, simply ask to rejoin and I can let you back in. The session is being recorded, but the recording is only of Jeannie and my own screen, so nothing else will be seen. Yeah, questions into the chat. Thank you for listening to housekeeping. Please enjoy the session, and Jeannie, it is over to you.
Thank you, Sarah, and thank you everyone. Lovely big attendance today, so thank you so much for coming. So yeah, we're going to be talking about the foot, and I've got my foot here as well. So some of it we will be looking at slides, some of it I will be talking to you about this amazing piece of equipment that we all have, and we've got two of them, feet. Okay, so they really are amazing, and I know they can be a source of pain and discomfort and frustration, but hopefully I'm going to give you some tips and ideas today how to improve foot function and reduce pain. So as we said, questions in the Q&A. Just obviously I'm a movement therapist. Those of you who don't know me, I'm a movement therapist. I really specialize in working with people with EDS and HSD, and typically the chronic pain that comes with that. I also have HEDS myself, so I'm very familiar with all the issues that a lot of us are struggling with. So I'm a movement therapist. That means I'm looking at the mechanics, the movement of the body. So I'm not a podiatrist and I'm not a doctor, so I can't diagnose any problems. Okay, I obviously I have a good knowledge of the foot and what goes on in the foot, but I'm not a podiatrist. Okay, so but I will be able to answer questions about the mechanics of the foot and why things might be happening in gait or in standing or in pain, etc. Okay, so I will do my very best to answer any questions, but I just wanted to sort of let you know that I don't know as much as a podiatrist would know about the actual, you know, what you need for your foot in terms of orthotics, etc. Okay, so let's get started. So yes, let me just put this on a slideshow, one moment. My computer's always a little bit slow when we do this. Oh, okay, let's go back. There we go. Right, hopefully we can all see that. Just let me know if there's any problems with seeing that. I'm just going to bring that back up. Sorry, 1 second. Okay, so yes, a pain in the hypermobile foot. And I'm sure many of us at some point have experienced pain in the hypermobile foot. So this is ideas and solutions to help with your foot and lower limb pain, because obviously it's not just the foot is connected to our lower limb, and obviously we've got our knee up here. So problems with the foot can impact things further up the chain, as we're going to explore today. Sorry, my computer always decides it doesn't want to click forward. There we go. So what are the objectives of today's webinar? So we want to look at some knowledge. What could be causing foot pain? Tools to help you recognize what might be causing your foot pain. And obviously, so we want some practical techniques to help us manage that pain. Okay, that will help us get our confidence up in our ability to move and be functional without pain. And obviously, as I said, I do have HEDS as well as POTS and MCAS. And I've been working with our community for 14 years now. So I've seen a lot of hypermobile feet over the years. I was just saying to Sarah that most of my day, I'm looking at feet and touching feet and realigning feet and trying to figure out what's going on with the feet. So I've seen a lot of feet, and it's one of my favorite subjects. I absolutely love the foot, because you're going to find out why, because it's so important to what goes on in the rest of the body. And then hopefully I'll give you some ideas, some solutions, the things you can do at home to help with our feet issues. Okay, so we've had, as I said, I'm a movement therapist. So my background is Pilates, but I've studied biomechanics, anatomy, neuroscience, and pain management. And I'm actually just undertaking an MSc in pain management as well, because the number one reason people come to see me is because of pain. So I want to do some more research around EDS, HSD, and pain. So I speak obviously for EDS UK in these lovely webinars. Thank you so much for inviting me back. And the EDS Society. And I was the EDS UK Community Champion earlier this year, which is a great honour. Thank you very much. So yes, just a little bit more about me. So I teach teachers and therapists, and I'm also the founder of the Zebra Club. Some of you may know the Zebra Club app. And, you know, my method of movement for hypermobility has been the subject of a research study between UCL in the UK and Clarkson University in the United States. So there is evidence behind the method as well. Okay. So just a little bit about pain in general before we get on to the foot. So we know that chronic pain is extremely common in hypermobility. And, you know, many of you, I'm sure many of you listening have experienced or are experiencing chronic pain at some point, if not always. 70% of people report having chronic pain before the age of 20. So that's a long time to be in pain. And of course, we can have lots of different types of pain. The nociceptive, neuropathic, which is the most difficult type of pain actually to manage, inflammatory, visceral, dysfunctional, migraine type pains. And many people will actually stop exercising due to fear, pain, instability, or being given inappropriate exercises. Okay, that's from Dr. Leslie Russick, who did a little bit of research into why people stop exercising. And of course, our nervous system, if we're highly sort of sympathetically driven, lots of sensitization, that can also go down and affect obviously the feet and pain sensations in the feet. So there's lots of contributors to our pain. So common foot issues, not all necessarily hypermobility related. Obviously, this would apply to the general population as well. But there are a number of things here that I do see more often in my hypermobile clients. So blisters, obviously, if we're blisters and what's the other one? Corns and calluses, they should really be together. We tend to see more of those sorts of things because of the alignment of the foot. And if we're putting more pressure in certain parts of the feet, and we're going to talk about what should be the proper alignment, hopefully you can see me as well. So if I'm putting more pressure in certain areas, that's going to cause, if you've got areas of hard skin, maybe under one of your toes or on your heel bone, that kind of tells you that you're putting more pressure in that area than in other parts of your feet. So really hard skin, corns, calluses, that can be an indicator that your kind of the pressure in your foot isn't quite balanced. Okay, so that could be something that we could definitely look at. Plantar fasciitis, bunions. I see a lot of bunions. So bunion is obviously when this big toe joint is adducted, so it starts to come across like this, and this bone can start to stick out on the side. And again, is that due for us more to joint laxity, that is able to happen a little bit easier than for some people? Okay, so I do see a lot of bunion type presentations. Okay, plantar fasciitis, now that's basically an inflammation of the underside of the foot. Okay, I see a lot of that in our hypermobile population. So the plantar fascia is this bit under your foot. It's we'll have a look at it later. It's a thick, sort of dense, tendinous material, and it actually comes all the way up and joins your Achilles tendon. So people get pain, obviously, with walking. especially in the morning, it can be quite stiff. Again, why do we get more plantar fasciitis maybe than other people? Is that due to the way our foot mechanics are happening? So gout, not necessarily. Neuromas, so nerve tumors, they can be quite common. Ingrown toenails, not so much, maybe. Overuse injuries and strains, absolutely. So those ankle strains. Do you ever have those days when you just walking, and maybe you walk a little bit more than you normally do, and you wake up the next day and you're in absolute agony? Yeah. And so that sort of overuse injury, where did that come from? You know, just going for a walk and I've caused a sprain and a strain in my tissues. Ankle instability, huge. Yeah. Rolling over on those ankles, very, very common because of this instability. This foot doesn't move, unfortunately, but you know, we have this laxity here, and lots of people roll over on their feet and cause sprains and strains. Heel pain, we're going to talk about that. So this is your heel bone. As you can see, it's quite a big, thick bone. And if you notice, it's only on one side of your foot. So the other side of your foot is on the outer edge of your foot. And the other side of your foot is actually just a fat pad. Okay, so there's not actually any bone here on the big toe side of your foot. So if you're someone who's pronated, and we're going to talk about that, you may be putting a lot of pressure onto a fatty pad that's getting irritated and inflamed, and that can be the cause of heel pain. So if you're rolling in and we've got too much pressure, see a lot of heel pain, unexplained heel pain. Clawed toes. Yeah, my toes used to be like this because that tells me a lot. If I see someone who's got clawed toes, it tells me a lot about how they're trying to stabilize the rest of their body. Basically, the toes are kind of the last resort. So whatever's not happening further up the chain, the poor old feet and the toes are left to deal with it. And so clawing the toes can be an indication that you're trying to use your toes to stabilize the rest of the body. It's a shortening of the front chain of your body. So it brings tension into the front. So you might get tension on this part of your leg and your foot, even your quad. So it's really not a great thing to have. But again, that's changeable. We can start to lengthen those toes and start to use the foot properly so we're not clawing the toes. Arthritis, don't know, obviously it's common for lots of people. Athlete's foot, that's just another foot condition. Delayed wound healing, yes, we know that we have delayed wound healing. So if you've had injuries, operations, etc., it may be taking us longer to heal. And that small fiber neuropathy, I have had a few clients who have this in their feet, makes walking, etc., being mobile very, very challenging, and it's a really challenging condition to deal with. So those, obviously there are more foot issues. Those are just some common foot issues that you may have heard of, you may be experiencing. I just thought we'd cover that here. Now, this is from Gary Ward, who he was my first podcast guest. If you're interested in the feet and learning more about the mechanics, he's the author of a book called What the Foot. And as I said, we talked a lot about the hypermobile foot in my podcast, which is on YouTube if you want to have a look at that. But he's basically a biomechanic expert of the foot. Now, he says when the foot hits the ground, so when you're walking and you hit the ground, a whole body reaction occurs. Now, what does he mean by that? What does that mean? A whole body reaction occurs when my foot touches the ground. Basically, what should happen, okay, is that when we hit the ground, it sets off a whole chain reaction through the whole body, all the way up to our head, of muscles lengthening and contracting. Okay, so some muscles are going to be lengthening, some are going to be contracting. But in order for that to happen, the foot has to go through certain mechanics. Okay, so it's going to be pronating and supinating, which we're going to look at later. So don't worry if you don't know what that means. Okay, so basically the message is the way we interact with the floor and the contact that we have with the floor is going to impact everything further up the chain. So you might be experiencing knee pain, hip pain, lower back pain, even neck, shoulder pain. Some of that or all of that could be coming from the foot, believe it or not, okay? We're going to look at why that might be happening, okay? So that's a really nice quote. That's how important the feet are to the rest of the body. Okay, so why are the feet so important? Obviously, they're essential, aren't they, for our everyday function, okay? We need healthy, functioning feet to be able to walk around to do our daily activities, okay? So essential for balance, you know, to be able to stand on one leg confidently and, in a stable way. How am I doing that? How am I standing on one foot in this picture? It's because I'm integrating, that second word, integration, integrating from the ground up. So there's no way I can stand on one leg like that and be stable unless my feet are interacting well with the ground, okay? So we need to kind of really understand how the feet are supposed to be interacting with the ground in order to feel stable further up the chain. And if you think about it, walking is actually an act of balancing. You have to take one foot off the ground, and for a split second, you're on one leg. Okay, so doing exercises like this, where you're balancing on one leg, can actually be really good for helping improve walking patterns. Okay, so stable feet, we're going to look at what would we consider stability of the foot, and obviously strength. You know, it's not just strength of the foot, it's strength of that lower leg up into the thigh, into the pelvis. Yeah, so we need some degree of strength. And I know that's really challenging when, you know, for whatever reason, illness, pain, etc., we maybe haven't been as mobile or able to walk as much as we might like. I know, you know, many of my clients really struggle with the amount of steps they're able to do. Some are only able to do a couple of hundred steps a day. It's, you know, there are all different levels, okay, and I appreciate that. And that's why we're going to talk about things that we could do at home that maybe aren't as challenging as this, as standing on one leg, not to begin with anyway. Strong integrated feet, and by that I mean the feet are integrated to the rest of the body. They're not just something that are kind of at the end of our body and we kind of forget about. Although, to be fair, we probably do forget about our feet until they give us problems, and then it's like, oh, my feet are really sore, it really hurts. But generally we put our shoes on and off we go, and the poor old feet aren't really given much attention unless they cause us problems. Okay, so I really want to think about the feet being an integral part of everything else that goes on in the body. So just have a little hands up, a little wave. Have you, the people listening today, visited a PT, a physiotherapist, a podiatrist at any point for foot and lower leg pain? I would imagine the numbers are quite big for going to see somebody for foot and lower leg pain, especially with sort of those ankle instability issues as well. Okay, so today we're only going to be looking at the foot and lower leg, but we're going to consider its impact on the rest of the body as well. So why might we have been visiting a podiatrist or a physiotherapist for our lovely feet? So as we just mentioned, biomechanical, so the mechanics of this structure, is that the problem? So have we got ligament instability? Probably, if we've got hypermobility, most of us are going to have some kind of ligament instability. Have we got a problem with alignment? And we're going to look at foot alignment in a little while. Okay, because if my foot, you see how beautifully it's supposed to sit with this lovely arch here and this lovely arch across the front. and the shin bones sitting in exactly that position, and all these little bones here sitting in exactly the right position. If that's not happening, then that could be a source of pain. If you have a look at this, I'll just bring it closer. So you can see all these little joints in the foot. Yeah, so our toes and up here into these joints here. We have the same amount of joints in our foot as we do in the spine. So we all want our spine to move, right? We talk about having a lovely, mobile, flexible spine because joints mean movement. But for many of us, either these joints don't move at all because they're collapsed, or they move too much, okay? And they slip and slide, and then we have that instability. So the foot is designed to move, but it's how is it moving that's important. And if we've got hypermobility, is it moving in the best way possible? Maybe not, okay? So posture, so it says postural there. Posture, again, is going to be an issue, and we're going to look at that. Is that a cause of our pain? Environmental, you know, what sort of job do I have? Am I standing up the whole day? So it's really tiring. On my feet, have I got a job where I do a lot of walking, or have I got a job where I'm sitting down a lot and I'm not really using my feet much? Yeah, so different things are going to impact the biomechanics. Then we've got the musculoskeletal, so deconditioning. We mentioned that earlier. If I haven't been able to exercise or move as much as I might like, am I deconditioned? You know, the tissue in our foot gets deconditioned just as much as any other part of the body. That will be contributing to pain. Tissue irritability, plantar fasciitis. Yeah. Have we been experienced just inflammation in our tissue in our feet? And then we've got the spasming, yeah, calf muscles. Hands up who's got very tight calf muscles. I'd be really interested to know how many people have got tight calf muscles, because tight calf muscles are a huge contributor to the mechanics and the workings of the foot, and a contributor to plantar fasciitis in many cases. Nerve impingements, yeah, compression. So if I'm collapsing into the ground, am I pinching nerves? Am I compressing those joints? Chronic generalized pain, obviously there could be pain being referred from somewhere else. Sciatica pain can come all the way down the back of the leg. Stress and anxiety, trauma, mast cells, all known to contribute to pain, okay? So lots of things going on, right, with this issue of our feet. Okay, so this might look like a familiar picture, excuse me, the presentation of a typical hypermobile foot, okay? So you can see here that this whole calcaneus structure, yeah, this bit here is totally rolling in, yeah? And you can see here the Achilles tendon. Can you see that sort of tendon that's kind of prominent there? So the Achilles tendon, instead of being straight, is now being curved, yeah, outwards like this. Okay, so the Achilles tendon, very, very strong Achilles, tendon, really integral for walking. We store a lot of energy in that Achilles tendon. It's what gives us our push off. It's what enables you to jump, yes, sprint. Kangaroos, think of kangaroos. They have very, very strong tendons because they can jump. Okay, but here, when the integrity of the Achilles tendon is no longer like this and it's more like this, how is that impacting that person's energy and power for walking? Yeah, so you can see that we're rolling inwards onto the big toe. Remember I said this part of your foot is just a fat pad? So this person is no longer weight bearing through this big, lovely bone that's designed to weight bear. They're weight bearing over here where we don't even have any bone. So this whole structure above it, what's going to happen to that? It's just going to collapse in, isn't it? So that could be a typical presentation. That's what I see most of the time. Occasionally, we do get people who are doing the opposite. So you might be one of those people who used to stand or walk, or maybe you still do, on the outer edges of your feet. A lot of people find that quite comfortable. So they stand and roll their feet out. So you're more in a supinated position. Okay, and some people, I don't see that as much, but that is definitely an option as well. Okay, so that's the presentation. So what is the foot? I'm not going to go into big anatomy. Okay, I think it's more beneficial to talk about practical bits, but just very quickly, we've already said the same number of joints as the spine. Okay, so joints mean movement. This is really weird. Nearly 1/4, so a fourth of your body's bones are in your feet. Because you can see, look how many little bones there are. There might be tiny ones, but that's a lot of bone, isn't it? So yes, amazing, but also a lot of potential problems, I guess, because there's lots of potential for movement and lots of potential for things to collapse on us. Yeah. So how do we build this integrity so that our foot looks like this? That would be amazing, right? That's what we want to do. That's what I'm hoping this webinar will help give you some ideas. How can I build some integrity into my feet? Okay. So you might have heard of the talus bone. So that's the bone on the top of the foot that joins the two shin bones together. So that's that big one. That's the only bone in the body that's not attached to anything, so it can move around and twist. And that's a problem for some of us because it can get twisted and dislodged and stuck. Okay. The calcaneus, the largest bone in the foot, that's this big guy here, the heel bone, basically. Okay. And then you've got your tarsals, which are those little bones here. Okay. These little irregular bones. The metatarsals are these bits here, the long bits. So these are all part of the toe, really. It's not just the little bits that we can touch. The bones come all the way down here. And then you've got these little phalanges at the end. And then the sesamoids, I just wanted to talk about that because I've had a few clients who get inflammation of the sesamoid bone. And it's this little bit here at the bottom. Can you see that? These bobbly bits here. Some people get inflammation. Now, why do we get, again, these are just my thoughts, okay? As I said, I'm not a podiatrist, but why do we get inflammation here in this sesamoid joint? Is it because we're rolling in and pronating and there's too much pressure going through this particular joint? Okay, so again, is that inflammation because we're literally just asking too much of one part of our foot? Okay, just a thought, I don't know, just the sort of things I like to think about. But yes, maybe I've got some hard skin here as well. Yeah, that could be a possible reason for some pain there. Okay, so that's a little anatomy of the foot. Okay, so just some foot facts, or my foot, that's a hard thing to say, right? Foot thoughts. These are my thoughts about the foot. That's an easier way of saying it. So the heel bone, I think, is the keystone to the whole body. So wherever this guy is going to really impact the rest of the foot. Okay. Now, how, again, we can't do hands up, unfortunately, but you can kind of raise your hand at home. How many of us lock our knees? I'm going to put my hand up, or I certainly used to. I was a knee locker. Most of my clients who come to see me are knee lockers. Locked knees, what is that? When you lock your knees, so your knees up here, excuse me, your knees are basically now acting like a heel. So the heel, which is designed, I keep coming back to it because it's so important, it's so thick and chunky, it's designed to wait there. You can look at it. The reason you have big bones in some places is because they're designed to wait there. Can you see how big and thick this is compared to your little toes here? Look how thin they are, okay? I noticed someone put a question on Facebook, and I don't know if they're here today, but they wanted to know why their toes dislocate. Now, obviously, I don't know because I don't know the person and I don't know anything about them. But if we're allowing a lot of our weight to collapse forward, what tends to happen with a hypermobile foot is the weight shifts forward. So I've kind of gone off the question of the knees now, but anyway, we'll come back to it, don't worry. If I've got too much pressure coming forward into the front of my foot, these tiny little bones, they're not really designed for weight bearing. So your toes, these are like your toes, they're like fine tuners. So they're there to kind of sense out the ground. Remember, our ancestors would be walking around barefoot, yeah? And their toes were used to kind of suss out whether there were sharp stones on the ground. You know, they were just there for a little additional information. They weren't there to put weight on, okay? Whereas this guy is designed to put a lot of weight on it, okay? So with a hypermobile foot, what can happen is all of this structure shifts forward. So you've got an increased amount of pressure here at the toes. Is that, or could that cause subluxation dislocation? I think yes, possibly, because they're so tiny, they're not meant to be doing a lot of weight bearing, okay? And I'm going to explain to you how you should be weight bearing in a minute. So if you lock your knees, coming back to this, your knees are now acting like a heel bone. And as soon as you lock your knees, you cut off information from the knee to the foot. So actually, and you might want to try this standing up, you know, when you lock your knees, you're not actually going to have that sensation in the feet anymore. It's much harder to feel connection with your feet. The knees are locked back and they are now acting like this guy here, okay, which isn't great for the knees either, right? Because they're not supposed to be weight-bearing structures. Okay, as I've said here, locked knees, we feel the knee and not the floor. Now, remember my photo of me standing on one leg, and I said, well, there's no way I can stand on one leg unless I can feel my feet in the ground or my foot in the ground. So if I've locked my knee back and I can't even feel my foot anymore, I'm not going to be stable. So we think, I call it false stability. We think that locking the knee makes us stable, and we kind of look for that stability and lock out. It's not stable at all. It's a very, very vulnerable position, okay? Apart from straining the ligaments and the muscles around the knee, it's just not a stable posture. This guy can give you a stable posture, okay? Not the knee, okay? So another reason why we need to back off those knees. If you've got a secure foot, I guess proprioceptively, your body, the information that comes up from the ground is that it's safe and secure. So your body starts to feel more secure. I know that sounds really weird, but when you're not safe on your feet, okay, so if you've ever worn high heels, yeah, I've tried in the past, high heel shoes, how safe do you feel? I mean, and if you've never worn high heels, just try and picture trying to walk on a little sort of heel like that. You kind of totter around, but you don't feel particularly safe. You know, any moment you could go. Now, if you're tottering around on high heels, what are your shoulders doing? What's your tummy? You know, everything's kind of like, oh my goodness, I'm going to fall over in a minute. So if our feet don't feel secure, that tension's going to creep up the body, okay? Fast twitch fibers, muscle fibers are in the front of your body, okay? So those are your more reactive, you know, sprinting muscles, and they draw you up and in. The back body has the slow twitch fibers. They're your postural muscles. They're designed to hold you up. Now, the sole of the foot, the back of the body obviously comes down the back here, under the heel, sole of the foot, that's considered part of the back of your body, okay? So that's designed to hold you up, okay? The muscles here at the front are not designed to hold you up, okay? All right, so just some little foot postures. Again, hands up who used to sit in the top left-hand corner there with their legs wrapped around. I know I did. A form of compression, obviously. Subconscious, if you've got POTS, helps to compress But it's also used to be quite comfortable, just wrapping those legs around and hanging into that posture. But I don't recommend it. Yes. So if you sit like that, please try to stop sitting like that. Hyperextending the toes. So if you come down the bottom, can you see how bendy those toes are? Again, we shouldn't really be going onto our toes unless you're a ballet dancer. Okay. And obviously ballet dancers end up having a lot of problems with their feet because they're balancing on these things that we've just said are not really designed for weight bearing. Okay. So the point where we should be putting weight is on the big toe pad, and we'll look at that in a little bit more detail, and you're going to try it at home in a minute. Okay, so this bit, not your toes. Hyperextending ankles, again, this doesn't move, but can you extend your ankle like that? That's another sign of hypermobility there in the foot. Another rolling in, presentation of a foot. And here on the top right, these pasogenic papules, these little, can you see those little sort of knobbly bits on the side of the heel there? So those are, you know, you do get them in other, you know, I've seen them in other people, but they're quite common in hypermobility, in EDS. They're little fat pads that kind of come through this, they're little bits of fat that come through the tissue because of the sort of laxity in the connective tissue. They can pop through. And when you're weight bearing, so they won't be there when you're sitting, but if you stand, these little bobbles will come out on the side of your foot. And that's a kind of a, an indication. I think it's one of the criteria as well for EDS diagnosis. Okay, so that's something else to look out for. Now, back to this foot that we looked at earlier. I'm just checking my time. Oh yes, because I talk too much, so I'm going to speed up because I want to make sure I get your questions. Is that really a pronated foot? Okay, my thought, and in discussions with that podcast with Gary Ward, is that that's not really a pronated foot. Okay, now people think, oh, you've got overpronated feet, and people think that pronation is a bad thing. Pronation is not a bad thing. The foot needs to pronate. It's a function of the foot. It's only a bad thing if you get stuck in pronation and you can't get out of it, okay? Now, I don't think this is a pronated foot because a pronated foot requires a specific order of actions to take place, such as for dorsiflexing at the ankle, the rotation of the bones, and the lengthening of this plantar fascia under your foot. So everything lengthens so that when you pick up your foot, it contracts again. Remember, all muscles want to do is lengthen and contract, lengthen and contract. That's all they do all day. But if you're stuck here, remember I said what tends to happen with the hypermobile foot, it doesn't pronate, it doesn't go through that three-dimensional action. It just slides forward and everything collapses in. So gravity, if you look at that, gravity is really just allowing that foot to collapse. The arches have totally collapsed. Again, we talked about the Achilles, everything's just rolling inwards. That is not going to be a very comfortable position. Okay, so this person probably doesn't have a pronated foot. It has a collapsed foot. Okay, and there's definitely things we can do to help that. Okay, but it's not a true pronation. So what is pronation and supination? So as I said, pronation is normal. We're supposed to do it. So here you can see the pronation. So everything's coming onto that, is going into dorsiflexion. The bones are rotating in and the foot is spreading. So the arches drop. Okay, so you do get a flat foot. Okay, when you come out of pronation, your foot does the opposite. It supinates. Okay, so everything rotates the other way and the arch lifts back up. Okay, and in the middle is what you would call a neutral foot, which is kind of what we would hope for. So these bones are nicely aligned and the foot is presented as balanced. And if we look at this, I quite like this because you can see the bones and how the bones are being distorted. So pronation, you've got that tilting one way, and supination, you've got the tilting the other way. Okay, so when you walk, you want to go through a phase of pronation and supination. Okay, but if you've got the foot like in that picture where everything's totally collapsed in, it can be quite hard to get your foot to supinate. And what we end up doing, instead of doing proper pronation and supination, we end up just kind of picking up the foot and plopping it back down, because the foot isn't doing this required action. Okay, but you can teach it to do that. Okay, it's not like you're stuck there forever. You know, I work with people all the time who have that presentation of the collapsed foot, and we can totally change it. Okay, so this is again just about alignment. So here is a lovely skeleton from head to toe, beautifully aligned. And can you see how the heel bone, if you look at the middle picture, the side on, the heel bone is in line with the tailbone, it's in line with the scapula, it's in line with the back of the head. Everything is lined up, okay? And then if you look at the front on and back on pictures, everything is nice and balanced because my foot is in a neutral position, it's optimum position. But what happens if this happens and I've got this dropped arch? Yeah, so here on the green one, he's standing in neutral. The red one has got the collapsed arch. Look what's happened to the alignment of the knee. The pelvis has dropped on that side. And because the pelvis has dropped on one side, the spine has to twist the other way. And then the neck has to twist the other way just to be upright and functional, because you'd never walk around all lopsided. So everything has to twist and turn. So can you see potentially, I'm not saying, you know, always, but potentially you could have an issue all the way up to your neck, to your shoulder, to your sternum, to your lumbar spine, to your pelvis, etc. Okay, so trying to understand what a neutral foot is can really help with pain further up the chain. So here's our foot, okay? Now, many people with hypermobility, this arch at the top, the anterior transverse arch, which goes across the top here, that's where we get a lot of pain, okay? And a lot of people, because of what I said before, that the hypermobile foot, the weight just shifts forward, this arch is obviously going to take the strain and it's going to flatten. And then we get pain across the top of that foot, yeah? So we ideally want to rebuild this transverse arch. Now, we always talk about needing a tripod under our foot. What is the tripod? And I want you to try it out in a minute. But the tripod, all of the little foot, so it's quite down here, it's not in your toes, look, it's down here. It's saying my internet's unstable, I hope you can still hear me. And the heel bone, okay? So your tripod looks something like that. Now, if you can find that tripod in your foot will more or less be in a neutral position, which we saw is quite important for alignment further up the chain. If you don't find that tripod, your foot will find another tripod. So you typically always have 3 points of contact on the ground. For many of us, that might be your toes, yeah? So that's what we need to look at in a second. And this is just a little bit I've taken from my anatomy book of the structure of the foot and how complex it is. So you can see at the bony level, that's what we've been looking at today, all the joints and everything. Then you've got those thick tendons. This is your plantar fascia. So the one on the right, yeah, very, very thick, like a yoga strap under your foot, and it spreads out because that tendon there is supposed to be a bit elastic. So it gives you a bit of bounce and a bit of support. Okay, but if it's totally stretched because all your weights come forward, that can be quite irritated and annoyed. Okay, and it's certainly not bouncy. sometimes I feel under people's feet, and that is just rock hard. There's no giving it at all. And when I touch it, they kind of nearly go through the ceiling sometimes because it's so sensitive. The underside of your foot should not feel like that. It should feel nice and bouncy and yeah, ready for action. And then you've got this lovely tripod of muscles that are kind of following the tripod under your foot. Okay, so there's loads of this beautiful layering under the foot. And then you've got obviously the foot that connects to the calf. So I won't spend too long on here, but it is really like a sliding network of muscles because you can see how connected they are. So it's not a foot and then a shin. This is feeding into the foot. That's why you can see how having tight calf muscles can really affect the mobility of your ankle and your gait, okay? Because the calf, which is here, also wants to expand and contract. But if I'm not walking properly, my calf doesn't get the pumping action, okay? That expanding and contracting, okay? So we talked about the Achilles, the tight calf. Yes, we've talked about all of this, okay? So, and that's just another diagram. So I said above and below, because really the energy that comes from underneath the foot is really important for holding us up. So it's not about the path of least resistance. And so we tend to hang into the front of our hips and lock those knees back, and then all that pressure comes into the foot, not in a neutral foot. We lose that tripod. So really gravity is just dropping us into the ground, and we're not responding to gravity with that energy that helps lift us up. Okay, so you do have to, and I don't want to say fight gravity because I don't want the connotations of tension and stress, but we do need to respond to gravity. Otherwise, we are just going to go down all the time. Okay, and we need to find that lift up. Okay, so possible causes, and we briefly talked about this earlier, alignment and posture. So hopefully we can see now from all the talking that we've done that alignment and posture will have an impact on our foot pain. Joint laxity will have an impact on foot pain. Structure of the foot, whether I've developed a bunion, I've got a neuroma, that is going to impact. And we have to ask ourselves, why have we developed that? Again, the neuroma, is that because I've been putting too much pressure in one part of my foot and it's caused that nerve issue? Gravity, as we just talked about, am I collapsing into it? Environment, we talked about earlier. Spinal pelvic instability. So it works the other way around as well. If my hips are very unstable or my spine is very unstable, I'm going to be working very hard to control that when I'm walking. That's obviously going to impact how I'm using my legs. So have I got enough glute strength to propel me forward when I walk, or am I picking my legs up and putting them down? So gait, walking, shouldn't be about picking the legs up and putting them down. Gait is very much about being propelled forward, okay, by the big toe pad, okay, which is why finding your big toe pad is so important, okay. So immobility in other areas. So if we block those knees, as we talked about, that's going to impact the positioning of all of these bones as well, okay. Proprioception, motor control, yes, we know that's an issue for us. If I haven't got fine motor control around my ankle, am I going to roll over? Yeah, that sort of thing could be going on. Balance, so if I don't have good balance and I'm wobbling, I haven't got that integrity that we talked about at the beginning. Breathing, like how can breathing affect my feet? That's just crazy. But it can, in my opinion, if you think about it. Remember what I was just saying, that we need to respond to the ground. We can't just collapse into the ground. Now, if I'm someone like many of us who has high chest breathing, dysfunctional breathing, and everything's stuck up here, I'm not going to feel any release or dropping into my feet. So I'm not going to make contact with the ground. and therefore I'm not going to feel that energy coming back up either. So actually learning to breathe and letting that dropping sensation can really help with proprioception of your feet into the ground. And we'll do a little experiment in a minute and see if you can feel that. So I think breathing can impact our feet. Okay, so solutions. What can I do with all my problems of my feet? So of course we can have braces, ankle braces, physical walking aids. We can use orthotics, and that's where an EDS aware podiatrist would be useful. And I know EDS UK are doing some educational work with Sophie Roberts from the Gate Lab, who is an EDS aware podiatrist. So, you know, there are people out there who are EDS aware and understand what a hypermobile foot needs. And many of you might use orthotics. And I didn't have an issue with orthotics. You know, I've referred my clients for orthotics when I think that we really need something else, we need a little bit of a boost, we need some help here, because the orthotics can help you find this neutral foot position. Okay, so if someone's really, really struggling for whatever reason, having an orthotic can really help. And I don't recommend relying on your orthotic 24/7. You've still got to do your foot homework at the same time. Okay, obviously you've got painkillers, taping, physiotherapy, appropriate footwear. You know, it's really important that we do think about our footwear. You know, things like wearing flip-flops, for example, you know, really, really not good for us, in my opinion. You know, cause a lot of problems. Very flat shoes can cause a lot of problems because if you wear very flat shoes, so, you know, trainers are great if you have like those ones that have got a bit of support. But very, very flat shoes are going to ask all these muscles to stretch. Yeah. If I'm in a flat shoe, this has got to lengthen. And if I've got any kind of restriction, that's a big old ask. I remember I wore flat many, many years ago, before I knew any of this. I wore that some very, very, I can't remember the brand, but they were super flat. And I wore them to a barbecue or something, a lot of standing. I was in absolute agony the next day because all of this stuff had to lengthen, and I had terrible backache as well because I was probably hanging into my knees, etc. So footwear is really, really important. Things like Alexander technique, you know, walking, how to hold yourself can be really useful. Meditation and mindfulness, obviously I'm a huge fan of calming the nervous system. The breathing patterns we just talked about, changing the nervous system response. So yeah, letting everything calm down a little bit. And obviously, you know, I'm a huge advocate of exercise movement programs for hypermobility. Okay, so I'm going to look at what exercises can I do to help my feet. Okay, so again, look after yourselves. You don't have to do this. Don't do anything that doesn't feel right for you. But if you would like, just a little experiment, and I regret I can't see you because I do like to see what's going on. But if you don't mind, and you can do this later if you don't want to do it now, just stand up for a moment. Now, there's no right or wrong about any of this. So, you know, we're not judging each other or anything like that. But just stand up if that's available to you. You could do it sitting down, yeah? But just notice, if you will come to a standing position, just notice, first of all, have a look down and look at your foot position. So are your feet parallel or are they turned out? Okay. If you're someone who turns your feet out, that's your brain's subconscious attempt to get you out of pronation. So if you've got that foot presentation where everything's rolling in, turning out will get you slightly out of that rolling in position. Okay. And when you come out of pronation, you then get your glutes to work a little bit. So your brain's desperately trying to get your glutes to work. Okay. So again, don't change anything, just notice if you're in that turned out position. Okay. Now, again, just notice, this is all part of the beginning. This is what I would do with a client when they come in. Notice if you favor one leg over the other leg. So are you more right or left dominant? Because if you're kind of leaning over to one side, that's obviously going to make your spine and your neck do funny pod like we saw in the picture. Okay. So are you balanced left and right? Okay. And are you balanced front and back? So remember what I said about typically everything's going to collapse forward. Are you someone who's got more pressure on the front of the foot? So we've got two presentations. They're either going to be a lot of weight on the front, or you're someone who puts all the weight on the back and the toes feel like they're not touching the ground at all. Okay. So ideally, let's talk about our tripod. So if you're someone who's really turned out, see if you can bring your feet into parallel as long as that doesn't hurt. Obviously, don't hurt yourself. Close your eyes if you don't feel dizzy, you don't have a balance disorder. I just find it helps, but you don't have to do that. So remember the tripod. I just want you to sense whether your foot is in its tripod. So can you feel your heel bone? Can you feel your big toe pad? So not your big toe, the pad. So that's the tripod. See if just for a moment, if you can feel that tripod. Now, ideally, the heel part of the tripod is on the outer edge of your foot, because that's where the bone is. Okay, so it can be in the middle here, but ideally I want it on the outer edge, especially if you're somebody who's totally rolling in. Again, look after yourselves. That might be a big change, so don't do anything that kind of annoys anything. But this is really important. Whenever you're standing, can you train yourself to start to look for this tripod? Okay, if you're somebody who's always leaning forward and allowing this through gravity to collapse forward, see if you can just bring yourself back a little bit more into that more balanced tripod. Okay, and it will feel really odd if you're used to being forward and then you're brought back. You are probably going to feel like you're about to fall over backwards. You're not. It's just that your brain feels totally different proprioceptively. Okay, so that weight bearing ability through the foot, how easy was that for us? Okay, so just a little experiment to have a little play. So what would exercises give us? Obviously mobility. The foot should be mobile because it has all these joints. So we know it's supposed to be mobile. It's not supposed to be stuck in one place, but it needs mobility and stability. So you can't just have a mobile foot. That's probably what most of us have got already. Yeah, we need mobility with stability. Okay, and finding your tripod is the first step to starting to feel a little bit more stable into the ground. Calming of the nervous system and learning to breathe and settle. We're going to build strength, confidence, and that feeling of safety and feeling supported from the ground up. And thinking of the foot as part of the whole body. Okay, learning to use the right muscles at the right time and not underuse or overuse other muscles. So we're not going to go through this. This is just a class, but it's got some ideas that you might want to try. Things like when you're standing, lifting your big toe off the ground. Okay, that's really important. The big toe is super important because it comes all the way up and up our leg, this muscle here. So very, very important. Can you lift up your big toe? Can you lift up your four little toes? If you're somebody who's got a totally collapsed transverse arch, that one across there, crunching and pressing, well, pressing your toes into the ground, okay, will create a transverse arch, and then just relax. So if you're really struggling with pain across there, just pressing your toes into the floor will help lift your foot up and build some strength under here to help build that transverse arch, okay? So rocking and swaying, we kind of just did, you know, am I balanced left and right? Am I balanced front and back? Tightrope walking, putting one foot in front of the other as I walk across the room. Very challenging, okay? Some things with the balls, squats with balls, bridges. Now, bridges are really good because they start to people using their feet and actually weight bearing through their feet. If standing is a bit of a challenge and doing a lot of standing work, start on the ground and start doing some baby bridges, just to start loading. You know, the way to get a strong foot is you have to load the tissue. Yeah, you can do things like scrunching up a towel, that's fine, it's better than doing nothing. But the way to strengthen a foot is to load the tissue so that it lengthens, but then we let it contract again. Okay, so most of us are in trouble because everything has lengthened and it never contracts. So we're stuck in this collapsed position. And that's what we've got to try and bring back, some of that integrity to the foot. I did have, but it's rolled off. I had a spiky ball to show you. Oh, here it is. Sorry. Okay, spiky ball massage. You might have seen one of these. It's quite soft. So if you invest in one off Amazon, don't get the hard plastic ones because they're really painful. But rubbing your foot on here, not if you're pregnant, okay? Please do not do that if you're pregnant because it stimulates things you wouldn't want it to stimulate. But if you aren't pregnant, you can rub your foot on this spiky ball and it stimulates the foot. And when you put your foot on the ground, you feel the foot and you feel a lot more connected to it, okay? So that's a foot massage with a spiky ball. Now on YouTube, I've got a load of exercises with bands, foot exercises. So you can go and look at my 5 a day for feet for a lot of these exercises. Now, Joseph Pilates invented this thing called I think it's called a toe corrector. And you put your toes, I'm not suggesting you go and buy one of these, don't worry, but you put your big toes in there and you pull apart. So very good for our things like our bunions, etc. Yeah, so you're pulling against the spring. Now, in the absence of a toe corrector, on my YouTube video, we do it with a loopy band, okay? Just, you can get these off Amazon really cheaply, or you can use a normal band and just tie a knot in it, and you pull apart, okay? And there's loads of other stuff on that YouTube video for how to strengthen the feet, okay? And these exercises are in a lot of them as well, okay? Oh, and just out of interest, Joseph Pilates also created such a thing as a foot corrector, okay? So you may have heard, if any of you go to Pilates or a Pilates studio, ask your teacher about using the foot corrector, because basically that's another spring here and you're pressing, let's do it with this, you're pressing your foot down to try and strengthen the front of the foot, and you're pressing your heel down to try and strengthen the rear foot. So there are lots of solutions out there. You know, Joseph Pilates clearly knew how important the foot was because he came up with all these ideas. So once we know where our neutral is, and we kind of understand our alignment a little bit better, we can start working on all that other stuff. And these are just some examples. So as I said, bridging in the top right is very, very important for helping you start to feel your feet. Then you've got things like balancing in a sort of a lunge position there, finding that integration between the front and the back foot. Things like putting your foot in a band when you're supine. So you can even do this in bed, right? You just put your band around the foot, around the balls of the feet like this, and you're pressing away, not just pushing it, but you're really pressing your foot into that band. Again, that's probably in one of my YouTube videos. And then things like on the reformer. Reformer, those of you who may have access to a reformer, absolutely brilliant things you can do for your feet. So there are loads and loads of solutions, okay? As I said, yeah, look at, oh, and I did a recent live YouTube video called Foot Solutions, and that has a whole movement class on the feet as well. So there's 2 videos for you to go and look at. Loop bands, and it's called 5 a day for feet, which is a 5 minutes, 5 exercises a day. And then this live class, again, loads of more lovely foot exercises for you to do. So just remember in closing, small steps, literally, yeah, small steps, everything counts, okay? If you're only doing 1 repetition, fantastic. Just start what works for you. We're not looking for perfection. We just know if it doesn't hurt when you're doing it, then it's great. Okay, we're not looking for perfection. moving with awareness. I can't stress enough how important, even if you're dealing with your feet, you know, moving with that awareness of your tripod, feeling the balance of your feet. It's really, really important, okay? Helps build that confidence that we talked about earlier. Obviously, pacing is really important. Don't start by going and walking 10 miles and, you know, things like that. Do what's right for you, okay? But it does come down to the approach. You know, how we're approaching the exercise is really, really important. And as many of you know, my method for hypermobility is these 6 principles. Posture, balance and posture come at the end, because the balance requires a lot of that standing work. Posture is going to come a lot from the feet, as we saw in those diagrams. If my feet are really connecting with the ground, I'm going to have a much better chance at having an integrated posture. So start slow, go low, always, okay? Even if the exercises seem easy, you know, don't think, oh, this is easy, I can do 100 of these or something. Don't think like that, because even the things that seem easy can cause us issues, okay? So start slow, go low. Okay, I think that's the end. So I am going to stop for questions. Thank you for listening. Let me stop sharing. Okay, and hopefully Sarah is there.
I am. Hello.
Hello.
Fab. Let me have a look. That was fantastic, Jeannie. Thank you ever so much.
I hope it made sense. Obviously, the feet, they're quite complex, you know. We often, as I say, we forget about our feet, but they have such a big role to play and can be such a big cause of pain and, you know, lack of mobility. So hopefully that gave us some tips for what to be looking out for.
Yeah, definitely. Fabulous. There have been a lot of questions. We'll try and get through as many as possible, but
yeah,
we're probably not going to be able to get through all of them.
Yeah.
And I kind of grouped some together when they're asking similar things. So one of the first questions was toe walking. One, for kind of doing it in case of bad pain in the heel, and 2, it then kind of causing really tight calf muscles, things like that. So any suggestions in terms of toe walking at all?
Yeah, is this as an adult? Because I know obviously a lot of children end up toe walking.
Yeah, so a 16-year-old and an adult.
Yeah. So, and obviously some medical conditions do make people walk toe walking as well. Things like tethered cord as well. People tend to prefer that because they're not putting pressure on that. Obviously not, if you haven't got something else going on and you've just literally got into the habit of toe walking, obviously we do want to work on, so you've kind of been walking like this, okay, so all these muscles at the front are getting very overworked and all these are at the back. The foot needs to be able to dorsiflex. So if you're toe walking, obviously this is not dorsiflexing, okay? So really my question would be why, why, let's investigate the heel pain. Where's that coming from that's forcing you to walk on your toes, yeah? So toe walking can be quite good because it helps build that transverse arch. So you've probably got quite a good transverse arch, but we don't want to stay like that, yeah? So I will be introducing very gentle things to encourage, lying on your back, doing ankle circles, pointing and flexing the foot, trying to get confidence at actually dorsiflexing that foot so that, and finding out, why have I got that heel pain? Where's that coming from? Is that something that I can treat so that I can start to weight bear? Remember, this guy is the guy that's supposed to be weight bearing, not these guys, okay? So yeah, hope that helps. That answers the question.
Perfect, thank you. Just trying to have a look. A lot of people talking about bones shifting or crossing over, top of the foot as well as in the toes and things like that. kind of basically any ideas or any kind of exercise or anything that can help with that.
Yeah, so again, if bone, you can see from here how many bones there are in our foot. So if you've got ligament laxity, the probability of things shifting and moving, absolutely quite a lot for us in hypermobility. Again, my question is, why is that happening? So why are certain bones shifting and moving? Is it because I'm putting too much pressure in a certain part of my foot, so it's almost subluxing, and shifting because of that? Can I work on finding my tripod so that my foot has more of a spread of pressure, so that one little area isn't taking all the load? Okay, so I would start by looking at that tripod again, just asking, standing there like we did just now, standing and asking yourself, where is that weight going through my foot? Is it evenly spread? Because if it's not, yes, you're going to have things slipping and sliding. Yeah, because they're just going to, you can see how tiny some of those joints are. They're just going to easily give way. Okay, so start with your tripod. Always come back to your tripod.
Brilliant, thank you. Just having, so lots of questions about pronation, and kind of say if one's worse than the other.
Yeah, one foot worse than the other. Yeah.
Just having a quick scan through. I know there were others that are the same thing. So basically, yeah, how to kind of deal with this, strengthen with it. I'm sure you've covered a bit of it already within the presentation. A lot of these questions are from the beginning, so I think a lot of them have probably been answered. Gone a lot.
Yeah, of course you can have one foot that's more pronated than the other. You can have one foot that's more turned out than the other. You could have all sorts of, you could even have one foot that's weight bearing on the front and one foot that's weight bearing on the heel. So you've got this, and of course, if that's happening, you're going to have some sort of rotation going on in your pelvis and your spine. Okay, so that again, if I've got that sort of thing going on, or one foot's more pronated than the other, a bit like that diagram we saw with the one foot that was pronated, you saw how it tilted the guy's pelvis and then his neck. Again, can I get back to my tripod? I know it sounds a bit repetitive, but the tripod was there for a reason, right? Because if we can get the tripod, then your body's going to be a lot more balanced. Okay, so it is perfectly normal to have different feet doing, different things to different degrees. Okay, but on both of them, try and find that tripod. Start from the tripod. Whatever you do, start from your best tripod and then start doing the exercises like the ones we talked about. I think that would be the best start. But yeah, most people I see have different feet. Absolutely.
Perfect. Advice on bunions. I know we spoke about the would it be again with the stretching?
Yeah, again, bunions, again, I highly recommend going to get advice from someone like a podiatrist, because there's lots of little gadgets that they have that can help. But yeah, bunions are generally, let's say, this big toe joint is quite big. It's obviously the biggest joint, and it can, if it's lax, this starts bending and then it pushes this bit out. Okay, so they can give you corrective things to help bring that back. But yeah, working on things like, not with the toe corrector, but even with your loopy bands, that can help. Can you strengthen this side of your foot, basically? Because if it's being pulled in, I've got to work on the muscles that pull it back out again, which is this side. Okay, so working with the loopy band, pulling it, a big toe lifting, things like that. But if it's real concern, because obviously bunions happen in varying degrees, I would recommend seeing a podiatrist to help with that, because obviously they're very painful for many people.
Brilliant, thank you. Lots of questions around different types of footwear. Would Birkenstocks be recommended? Barefoot shoes, kind of trainers, boots. What would be recommended?
Yeah. So again, a podiatrist would be able to, they have literally, literally pages and pages of recommendations on footwear, because obviously that's what they do all day, right? They're looking at people's footwear. So, Birkenstocks, I think I've heard good things about that, because obviously they do have that support. Some people, you have to, it takes time to get used to them. The thing with them is they're quite rigid, aren't they? So again, they're a bit like a hard insole. Some people won't like them because they're really rigid. There's no give in that foot. Trainers, I like trainers if they've got good support around the ankle. A lot of people like wearing boots, so actually covering the ankle to help support on the, what are those boots called? Not Dr. Martens. Yeah, people like things like that are really quite, or hiking boots, really quite structured around the ankle. A lot of my clients wear those. Definitely don't wear Ugg boots. Please don't wear Uggs, because they just encourage the collapsing in. Yeah, so stay away from the things that are soft and squidgy and aren't going to give you any support. And again, my bugbear is flip-flops. The Fit Flops, I think, are quite good, the brand, but general flip-flops, I'm getting my tongue-tied now, I don't like, because they don't offer any support at all. And so many people, after the end of every summer, people come to see me and they say, oh, my feet really hurt, they really hurt. Oh, what have you been wearing? I've been wearing flip-flops all summer. Okay. That's why your feet are really hurting. So stay away from those. But yeah, everyone's going to be different. Find something that feels comfy and supported and go for it. But if you get stuck, a podiatrist will be able to help you with specific brands. And there are some very specific brands out there for hypermobile feet.
Perfect, brilliant. Very quickly, I know a lot of people are asking if this is being recorded. Yes, it is. It will be available afterwards. And also, I know a few people had problems with time. It's something to do with when it gets added into a calendar, depending on the calendar settings. So again, it's all recorded. You can watch back on anything that you've missed. Quite a few questions about plantar fasciitis and dealing with that in terms of kind of what's best.
Yes. So on my YouTube video channel, the A to Z of hypermobility, I think it's the letter F. We talk about feet and fasciitis. So there's a little mini class on plantar fasciitis. So how to treat it, what exercises to do with it, okay? But what that video will show you, and as I mentioned in the presentation, a lot of plantar fasciitis is caused because the calf muscles are so tight. And so these, because it's all connected, these calf muscles are pulling the fascia up. So imagine, I would describe it like this. Imagine putting on a pair of socks that are too small for you, like a child's sock. Imagine trying to squeeze into a child's sock. And you'd be desperately trying to pull it up your shin, wouldn't you? Like, oh, I'm going to get these socks on. Think of what happens under here when you're desperately trying to pull on that sock. Everything's getting tight and squashed and not very nice. You can't even move. That's what happens when your calf muscles get too tight. All of the structure under here gets pulled. And if it stays like that, guess what's going to happen? It's going to get angry, it's going to get inflamed, and there's your fasciitis, which is inflammation. So that class will have a lot of heel raises, a lot of ankle circles, a lot of stretching, dynamic stretching, of course, dynamic stretching for the calf muscle. Okay, but yeah, go and look at the A to Z of hypermobility. I'm sure it's under the letter F for feet. And that's a mini class for you. It's a pain, literally, but it is treatable. Okay, so don't get disheartened. I know it can last a long time, but don't get disheartened with it. Okay, you can get rid of it.
Questions about being flat-footed, so whether it's come on kind of later in life or is progressively getting worse, kind of how to reduce the chance of it getting worse, taking it back.
So I guess it can get worse as we get older, because the more sort of weight bearing we do, this is going to get more stretched. And but of course I see children with totally flat feet as well. So how to prevent it getting worse is to start thinking about the structure of the foot and start doing exercises. So honestly, most people I see have those feet that we saw in the photographs, pronated. Well, remember, they're not pronated, they're just collapsed. We totally change their feet, okay? So they start to develop arches again. They start to have structure to their foot again, okay? Again, start with the tripod, think about the alignment, and then start doing some of those footy exercises, okay? Again, I've got videos on YouTube. There's one all about alignment that will help you with how to find proper alignment in the whole body, okay? But, again, don't panic about it. The foot, the reason we have a flat foot, if we're talking flat feet, is because of two reasons. Gravity, and we said gravity just wants us to drop into the ground. So gravity and that hypermobile posture of everything sort of sliding forward, okay? And the tissue here in the foot being deconditioned, just like any other muscle, like my arm muscles, like, this is like any other body part. It gets deconditioned. How do I train my biceps or my back muscles? I do exercise, okay? So my feet are no different, okay? So whatever you want to start doing, have a look at some of my videos, heel raises, weight bearing, working with the loop bands, whatever you want to do. But if you can start to feel comfortable in your tripod, already your foot will start to look different. I promise it will start to look different. Okay, but when we're not finding the tripod and everything's collapsing in, yes, it's going to present as a totally flat foot. Some people it will take longer than others, obviously, because we're all at different stages. We've all got different conditioning levels, but it is possible. And some people might need a little help from an orthotic, and that's okay too. Okay, if you're in absolute agony, right, and you can't walk, because your feet are so painful, the orthotic that's when you need the orthotic. Okay, because that will just give you a bit of respite so that you can actually start doing something. Okay.
Perfect, thank you. Some questions about orthotics and children, kind of when's an appropriate age for them to begin wearing orthotics, and kind of in and around that for them.
Yeah, I mean, as I say, I'm not really an expert in orthotics so I wouldn't like to say. I would definitely get advice from a qualified podiatrist. And I always say, especially with children, you don't want to put them in orthotics and have them rely on them forever. You do still want to be doing the foot exercises, because ideally, especially in a young foot where the tissue is more responsive, as you get older, it gets a little bit harder, right? Our tissue gets a little bit, but in a young foot where it's more responsive, there's so much you can do. Like my son was told he had feet like flippers, right? When he was, that's what the physio said. You've got flipper feet, which is awful, right? What a horrible thing to say. But that's what they said, because he was totally collapsed. And they were like, he needs orthotics. And I'm like, well, okay, let's give some exercises some go first. So we did some of the exercises. I made him do them every day. And he developed an arch, and he never wore orthotics. So, everyone's different. I'm not saying no, but if you do go down the orthotic route, just make sure you are doing the foot exercises as well, so that maybe the foot has a chance to develop and change. Okay, but please speak to a qualified podiatrist about that.
Thank you. And high arches as well. So we had quite a few people comment that sort of being flat-footed, that they've got an extremely high arch. and kind of how to
Yeah.
combat that.
Yeah. So I do see that, not as often, it's much, much rarer. But I do have some clients who have very, very high arches, still hypermobile, but high arched. Okay, so the foot is kind of stuck in that, instead of being totally squashed into the floor, it's exactly the same problem, just the other way around. It's stuck up here. Okay, so what do we need to do? If you think about what's happening to that tissue now, it's very, very tight, isn't it? So here it's been stretched long because I'm collapsed. In a high arch, it's the exact opposite. It's being pulled very, very tight. So it's probably quite sore under here. So we want to do things to allow that high arch to lengthen. Yeah. So little things like, well, the big toe lift would be a good thing because you're contracting and lengthening that. The spiky ball massage is very nice under the foot because you start to massage that very tight tissue. What you want to do is introduce your foot. Basically, what we want to do is introduce the foot to an alternative. Okay. So everything about rehabbing a foot comes back to, is it in neutral? Does it know where its tripod is? And then if it's stuck in this high arch position, what can I do to help it understand that it can go down? Yeah, it doesn't have to be stuck up here. So massaging it with the ball, doing some pointing and flexing with the band. So again, all changeable. Everyone's got different foot shapes, of course, and some people are just going to have different foot shapes. If it's not causing pain, then is it a problem? You know, you have to think of it that way. If I'm not in pain, then it's not really an issue. If it is in pain, then what can you do to introduce it? If you're in a high arch position, are your front tripods touching the ground? Chances are they're not because you're lifting up. So again, trying to find that tripod and giving it a little bit more movement and offering it an alternative.
Perfect, thank you. I think we've got time for one or two last questions. What about getting to see you? There's quite a few people asked.
Yeah.
About how to see you if you're available on the NHS and whereabouts you're based.
Right, yes. So no, I'm not on the NHS. So I work independently. So I'm in London, but I also have Zoom consultations. So I do see people face to face. I do have a bit of a wait list. So you can look on my website and jeanniedebon.com, and if you go to the book now button, it will show you the availability. But yeah, it is a bit of a wait. The Zebra Club obviously is my online program, and we have loads of classes in the Zebra Club for feet and pretty much every part of the body. And through the Zebra Club, obviously you get to work with me straight away through the app and through our live events, and you can ask me questions, etc. on the app. So, you know, the Zebra Club is a really, really fantastic resource as well. If you can't get to see me straight away, I would have a look at that. And we do a free trial as well on the App Store if you just want to have a look around and try it out.
Perfect, thank you. And then final question of today. I had a few people ask just to go over again finding that tripod and knowing where your tripod is. I think people are having a go and going, oh, I'm not sure what's going on here. Oh,
good. I'm glad people were trying it at home. It's the best way to do it, is just have a little play with it. So yeah, so when you stand, so one of those exercises on that list was called rock and sway. So I always get my clients to do a rock and sway. So when you're standing, okay, gently rock. Don't lift your feet off, but gently rock your body weight from the left foot to the right foot, like there was a gentle breeze blowing, and it's just gently swaying you from left to right. So again, you feel the pressure go in and flatten one foot, and then you come off it and it kind of lifts up. So once you've done that a few times, find your center. So find where you're pretty much 50% on the left foot and the right foot, okay? So like when you're wearing skis or something, or, you know, ice skates. Then you want to do the same front and back. So you gently bring your weight forward. Obviously, look after yourselves. And it's very small. You don't have to we don't want you falling over. So gentle forward, gentle back. Okay, so I'm putting pressure in the front and then I'm putting pressure on my heels. So I'm just rocking like a gentle breeze forward and back. And then you've got to find the middle. So where have I got 50% of the weight on my front foot and 50% of the weight on my heel and 50% left and right? So you've got 25% really on each corner, haven't you? That's going to make sure you're balanced. And that might feel odd as well if you're someone who's used to being forward. Once you've got that, can you pay attention to your heel bone? Ideally, the outer edge of your heel bone. And then can you find the pads of your feet? Okay, don't deliberately roll your feet out or anything like that. It's more of a sensation. And without going into it too much, watch the foot class on YouTube, the foot solutions class, because I teach you how to spiral your bones, which we can't go into now, but you can do it in the class. But basically what happens is the bones start to spiral up and out. Okay, and that will make more sense when you watch the class. But if you can find the rock and sway and then pay attention to the heel, the outer edge of your heel, and those 3 points, you should be pretty much in a neutral foot. Now, once you're in that neutral foot, your body's going to start to feel very different, and then you can try and exercise from that position. Okay, but please do go watch all the videos because they're good fun, and we do lots of foot exercises that I think you'll find very beneficial. So I hope that helped with the tripod.
Brilliant, thank you.